As part of the 8 actions to quickly and practically address health inequalities, there was a strong sense across our group that without clear and accountable leadership at all levels of the NHS, progress will continue to be limited. For the group, this became the highest priority and is about ensuring that the NHS better contributes to addressing health inequalities and requires clear, inclusive and accountable leadership from people like me and others in leadership positions across the NHS. This can't be just about hierarchical leadership, but there is no getting away from the fact that accountable officers must take responsibility for change at both the organisational and system levels of leadership. To strengthen leadership and accountability further, there will be an expectation that all systems, whether they be integrated care systems or sustainability and transformation partnerships, and statutory NHS organisations, should identify by the end of September an executive board level lead for tackling inequalities. To be clear, this should not be designated to non-executive directors. While we are certain that most NEDs are passionate about tackling health inequalities, there needs to be a continuous, day-by-day focus on bringing about this change that we need to see across organisations and systems alike. We are also asking primary care networks to nominate their clinical director or an alternative lead to champion health equity. We recognise the existing leadership asks of the recently emerged PCNs are considerable, but we know that there is a passion and commitment across primary care to tackle health inequalities. Therefore, we believe that a collective leadership focus should further strengthen existing accountability arrangements. The NHS's role in addressing health inequalities will also be enhanced by ensuring that our people reflect the diversity of the communities we serve. NHS organisations have therefore been asked to overhaul recruitment practices by October 2020. This is to ensure their workforce reflects the diversity of their community and to urgently review their senior talent pipeline. Each NHS Trust and CCG has important objectives in this regard, which it will be essential to progress in the coming months. NHS England and NHS Improvement is itself committed to ensuring that at least 19% of its staff come from a Black, Asian or minority ethnic background at every level, including board level, mirroring the proportion in the NHS workforce as a whole. The reality is that 250,000 of the NHS workforce in England is identified as Black, Asian or minority ethnic. Therefore, the desire for change is not just about representation or numbers, but it is about mobilising this collective knowledge and experience to not only continue to provide fantastic care, but to expand our role as powerful advocates for health within our local communities and at the level of national policy development. The NHS is driven by the fundamental principle of doing the right thing for our patients and our people. Now is the time to tackle health inequalities head on. Thank you for playing your part in this.